What's up, everybody? I have been getting a lot of questions and a lot more patience on a medication that I like to talk about and use often, and that is Pentosan. And it's a very powerful regenerative med. It actually started off as something more in veterinary medicine, treating degenerative disc disease, and more recently for patients that are suffering from bladder cystitis. Often, when this is being used, it's an oral form, which actually can cause some issues with the eyes. Fortunately, we only use injectable, and with that, it can actually be used long term if necessary. So, obviously, I'm all about regenerative medicine because it's something that personally use. I have knee issues where I am consistently using different properties to maintain, to heal that, because I'm not quite ready for surgery at this point in my life. But I have children and I love my life and I want to be able to continue hiking and dancing in the rain. So, what exactly is Pentosan? It's actually derived from beech trees. And that sounds kind of strange, but a lot of the really best medications actually come from nature. Some such as like aspirin, which comes from willow bark. And again, Pentosan is just one of the most powerful, promising anti-inflammatory tools that we have. Interesting thing about it is it actually mimics something called glycosaminoglycans. I'm not sure I'm saying that correctly, but regardless, it's actually something that our joints, cartilage, and connective tissue are actually being made from. So Pentosan mimics these, which means that we are naturally able to help heal the body, and it's actually speaking its language. Another thing that happens as we get older, we often will have reduction in synovial fluid. So knees are going to start getting creaky, because I have some pain. So Pentosan actually helps with improving that. And it also boosts something called hyaluronic acid production, which actually makes the lubricant itself. So your joints are going to feel less like sandpaper and more like they're supposed to actually feel. Another interesting property of this is that it helps with reducing pain. It decreases something called NGF. So you're not just numbing it, you're actually reducing the pain. And then even more interestingly, joints and bones are essentially avascular, but they do have microvessels. And something that's very exciting about Pentosan is it actually increases the circulation to joints and bones specifically. And then even things that you're using like nutraceuticals, collagen, different peptides or different injections, these actually increase the likelihood that they are going to get to the bone or to the joint. And then pretty miraculously, it's not just going to help with reducing inflammation in the joint itself. It's also going to be systemic. It decreases some biomarkers like IL-6, TNF-alpha, amongst the other ones. So not only are we getting a reduced localized inflammatory response, we're also going to see systemic. So people may actually feel better in general in other ways. And then it also can help with reducing the time that it takes to have bone healing. I've had a few patients where we've used this with, and we've seen some real cases where we are actually seeing improvement. I'm often using other types of peptides and nutraceuticals, but with this, we're going to see structural repair accelerated. So this is one of my very favorite tools just from injuries in general. And then again, while we're using it, we're actually seeing regeneration. This has potential for real cartilage rebuild. So it separates it from other anti-inflammatories. It's not just like ibuprofen, which has its own side effects, but it's not just protecting the joint, it's actually helping rebuild the tissue. So this is regenerative medicine. This is not just a symptom management situation. And whenever I'm using Pentosan, it's typically not the only thing we're using. It's something that hits a lot of different mechanisms, but we're also going to be, again, I've mentioned it a few times, things like collagen, liposomal vitamin C, different small molecules like Cartilage or BP757. When necessary, we're also going to be looking at exosomes and stem cells. And then even I have some patients that do really well with something like Nandrolone because it actually going to help with structurally rebuild and is also beneficial with synovial fluid. So you got to kind of just piece together the protocol that makes the most sense to recover somebody's injury. But at the end of the day, this is a great medication for athletes, golfers, the builders, or a parent who just wants to keep going and do his best in life. But really, anyone who has miles on their body. But this is one of the very best tools I've got. And again, I'm starting to use it more and more in my practice because I'm seeing so many amazing benefits.